Hello, my name is Anaya Warren, and for this project, I will be discussing marijuana. So first, I want to start out with this project about what exactly is marijuana. So marijuana is a drug from the dried flower named cannabis, and that goes by many names like ganja, Mary Jane, which many of us have heard in songs, weed, which is one of the most common names used for marijuana, pot, grass, and there are many other names used for it. Marijuana can be consumed in numerous ways. A lot of us know it to be smoked in either, hand-rolled joints, um, used in pipes or bongs, or even smoked in blunts, which are cigar rolled marijuana. It can be consumed as edibles, which is like the food version of marijuana and things like desserts, like brownies, or it can even be brewed as a tea. So marijuana does contain a chemical called THC, which is responsible for the psychoactive effects of marijuana. And this chemical is what provides that intoxicating effect that most users seek out. Um, Marijuana also contains other chemicals that are related to THC called cannabinoids. And an example of cannabinoids are endocannabinoids, which work similar to THC, which can bind to receptors in the brain and um, alter our reaction to it. So that leads into how does this exactly work? How does marijuana provide those psychoactive effects? So THC binds to what are called cannabinoid receptors upon consumption. And those cannabinoid receptors are molecules on neurons within the brain. The binding of the THC activates these receptors and causes the disruption or the change in the physical or function of the brain. So this affects the brain's reward system and it releases a chemical called dopamine, and that really produces a pleasurable high that most users do seek out when smoking marijuana. And the area in the brain affected when THC binds influences thinking, it influences concentration, pleasure, memory, and sensory or time perception. And that takes us to our next topic, which is the effects of marijuana. So a lot of people, like alluded to previously in the presentation, use the drug seeking the euphoric effects. So you can have a sense of relaxation, you can experience increased appetite, heightened sensory perception, like seeing brighter colors or just hearing a song better, the instruments in song better, or even altered perception of time, which actually can possibly be dangerous if it does maybe slow reaction times. And that in turn leads to possible adverse effects of using marijuana. So because marijuana is usually sought out for euphoric effects, people don't really consider that there can be possible adverse effects, and that does include slower reaction times. So that means it can impair someone's judgment, making something like driving extremely dangerous. So that is not recommended at all when using marijuana. It can also cause anxiety, fear, or panic. So that could also depend on the type of strain of marijuana being used. So something like sativa would provide a more head high, and something like indica can provide a more body high. And depending on which one, which has different chemical compositions, it can provide different effects. So that is important to keep in mind. That being said, it is important to note that the pleasant effects of and experiences related to marijuana are not universal, and it may not affect everyone in the same way. And then finishing off with this, increased heart rate can also be an effect of smoking marijuana. And in more extreme cases, there have also been cited notes of nausea or vomiting, or even temporary hallucinations or paranoia. And some possible consequences of this, if there is prolonged or heavy use of marijuana, there can be a formed dependence or addiction of marijuana. Now, addiction is much more rare due to what is available to the public is low on the THC scale, but dependence can be described as the compulsive use of cannabis throughout the day and attachment to the effect of the consumption of it that can possibly cause an intense craving. It can also cause problems during and after pregnancy if smoked, which can affect child development. And because some of this is smoked, it can cause breathing problems. A lot of people report short-term memory problems if using marijuana for a long amount of time. And then there's something called amotivational syndrome, which can be described as users who claim have lack of motivation or life satisfaction if used for a prolonged amount of time. And then finally hitting the scope of marijuana use. So it is the most commonly used psychotropic drug in the US, and there is a growing population of teens smoking it because of the rising trend called vaping, which is using an electronic device to heat up marijuana and smoke it almost odorlessly. So there has been a rise in smoking among teens, and about 11.8 million young adults have used marijuana in the past year. So due to the rise in the use and decline in relative perception of risk factors, it's important for health educators and society alike to be knowledgeable about the possible risk factors, outcomes, and consequences of using marijuana, because there are both positive and negative risk factors and outcomes, whether we like to think of them or not. And that concludes my presentations, and this is the references I used.